Hello everybody, my name is Adrian Barragan. I'm a faculty at the Department of Veterinary and Biomedical Sciences. Along with me today is Dr. Brown, also a faculty from the Department of Veterinary and Biomedical Sciences, and Dina Johnson, which is a student with our department. So in this video now we're going to talk about the proper procedures to open the body cavities in a deer. So the first steps that we need to do in order to open the cavities is to remove the limbs, to reflect those limbs back to allow us to access to the actual walls of those cavities. The first limb that we are going to reflect back is the front limb. When it comes to the front limb, as I mentioned before, the deer does not have a clavicle, a collarbone, so the only that we have to cut while we do this is only soft tissue. It's going to be mostly fat tissue and the big muscles that attach the scapula towards its thoracic cavity. We'll try to get our cut as close as possible to the rib cage in order to help us remove the rib cage more easily once we are ready for that. So now for the next, to remove the rear limbs, we also got to start cutting the soft tissue first. We're going to cut the big muscles, and in this case we'll have to articulate the joint between the femur and the pelvis. We'll see, we're cutting the soft tissue, and then we can see the head of the femur right there that is articulating with the acetabulum or the socket of the pelvic bone right there. And after we found the joint and de-articulated that joint, basically we just gotta finish cutting the muscle tissue around, and we'll finish reflecting back that limb towards the back of the animal. So once we finish reflecting the limbs back, now we're gonna start opening the abdominal cavity. The first step to open the abdominal cavity will be identifying by palpation the xiphoid cartilage, which is the cartilage right attaching to the end of the sternum, right here in the middle line of the animal. So once we identify that cartilage, we're going to do a small cut, big enough only to fit 2 fingers, with the blade of the knife facing in. And after we do that small cut, we're going to do a canal with our fingers to protect the internal organs from the knife. So now I'm going to continue this cut all the way to the pelvic bone, and now the blade of my knife is going to be facing out, so to prevent any puncture of the internal organs. So once we reach the pelvic bone, we're going to continue that cut all the way up to the vertebra, to the lumbar vertebra, where we'll keep that cut, where we'll continue that cut, now cranially and parallel to the vertebral body, all the way until the last rib. In this case, I'm gonna switch positions. Always make sure you're protecting the internal organs from the blade of a knife as much as you can. And then once I reach to the final rib, to the last rib, I'm gonna make a mark to guide my bone coaters through the soft tissue on top of the rib and also on the top of the bone, all the way from the last rib to the first rib. Then I'm going to do exactly the same in the other side, from the last rib all the way to the first rib. The next thing that I'll do an incision in the abdominal muscle, so Dina can help me she will keep putting a small pressure on that to help me remove the rib cage. And now with my bone cutter, I'm gonna start cutting the ribs. I do it dorsally or in the proximal section of the ribs. And then one thing I'm gonna do first, I'm gonna cut a soft attachment of the rib cage to the abdominal cavity, or that is the diaphragm muscle. And now we're gonna continue my cut in the distal portion of the ribs, actually through the costal cartilage. And now I only have to remove some of the soft tissue that is attaching the cavity, and make sure that I cut all the ribs. And finish the process. In the next video, we'll be looking at the different organs in the cavities body in situ before we remove those organs for doing a further exploration of those of each specific organ.
Okay, in this next video, we are going to examine all of the tissues and organs of the white-tailed deer in their natural position. So in a necropsy or in a dissection, we will pull these organs and tissues out individually and look at them in closer detail. But it's always good to look at where they actually lie when they are in the animal. So as we've seen in previous videos, we have removed the thoracic wall, we've removed the abdominal wall, and so all of these tissues are where they would naturally lie in the animal. If we look at the internal organs and body cavities of deer, we have two compartments in their body. The first is the thorax, that is the part of the body that is covered externally by the rib cage. And so it comes from this part here until the diaphragm, which is that muscular tissue right behind the lungs right here. And so from this thoracic inlet to the diaphragm all encompasses the thorax. The thorax, or also called the pleural cavity, is lined by some serous membranes, and it divides the thoracic cavity into a right and a left half. And running down the middle is a structure we call the mediastinum. And oftentimes when you're field dressing your animal, you may cut right through that and not see it at all. But if we reflect the lungs back a little, you can see this is the heart. There's the mediastinum right here. And it's this space in between the thorax that separates it into a right and left half. And that is where the esophagus runs through, a lot of the major vessels, as well as the heart. So this is the thoracic cavity. Again, externally, that's going to be what's covered by the ribs. If we move caudally in the animal, past the diaphragm, we're now into the abdomen. And this is going to be where a lot of those internal organs occur. Everything from your liver to your rumen to your kidneys. It'll be everything sort of caudal to the rib cage and caudal to the diaphragm up until the pelvis of the animal. So if we start on the cranial end of the animal and sort of walk our way through the different body cavities, coming down from the head, we have two tubular structures that run together down the neck. One is the trachea, or the windpipe, which is a series of cartilaginous rings that run all the way down the neck from the nasal and oral cavity, oropharynx, into the lungs. Running alongside of it, we also have this thin muscle-walled, very pliable tubular structure, which is the esophagus. That's what goes from the oral cavity, and what food and drink goes through. It passes through the thorax, which we can see right here, running over top of the lungs. It actually moves through, here we can see it still, moves through this diaphragm and continues on to the forestomachs of the deer. That is the esophagus. The trachea, again, this series of cartilaginous rings, your windpipe, comes into the thoracic inlet and then goes through a series of branches until it enters into the lungs. And that's what we see here. In most healthy, normal animals, this should be a pink, spongy material. This animal, it appears, had previous bouts of inflammation or pneumonia, and so it tends to have more red to dark brown areas of the lungs, and that's the areas of previous pneumonia. Typically, this should almost be this color right here, a nice pink, spongy, air-filled structure, and this is the lungs. You have multiple lobes of the lungs, and you have lungs that split, and there are two on either side, a right and a left side. So right here we're looking at the right lung. Underneath the lung, but also in the thorax, is the heart. And here we can see it in its natural position here. The heart is actually covered in a fibrous and fluid-creating or serous sac, which we call the pericardial sac. So if we use our forceps and make a cut, we can actually open that. And so here, we've made a little nick in the pericardial sac, and we can see that sort of darker red maroon tissue, and that's the heart itself. So this pericardial sac is a fibrous sac. It surrounds the heart. There shouldn't be anything in it but a little bit of small clear fluid, and that sort of helps lubricate the heart as it beats. If you see anything else in there, like hemorrhage, pus, anything like that, that's a lesion. So here's the heart. Again, it's underneath, sort of in the thorax where the lungs are, and that heart is in that mediastinum, that potential space that separates the thorax into a right and left side. As we move past the thorax and past this diaphragm, this thin muscular tissue, we're now into the abdomen. The first thing we run into on the abdomen is this structure here, which is the liver. It can be, depending on the nutritional status and a variety of other factors, it can vary somewhat in color, but typically it's going to be sort of a mahogany to brown color. It should be uniform in consistency. If you see any pus, any lesions or redness or darkened areas, that is a potential lesion that you're looking at. Deer are a little unique in regards to mammals that they do not have gallbladders. So in many mammals, they will have a sac-like organ within the liver. That is a structure that holds the bile that helps mammals digest fat. Deer do not have that. They still create bile for fat digestion, but they do not have a gallbladder that holds it in place as a storage container. So this is the liver here. First thing you see after you pass that diaphragm. If we follow the esophagus, again, here we can see it coming through the thorax. It passes through this diaphragm. It continues on to the forestomachs. And here you can see a good example of why Dr. Berrigan recommended that we always put the animal in left lateral recumbency or with the left side of the animal down. All of this structure you see is the rumen. And so if we put the animal on the right side down, when we open this up, this is all we would see looking down at it. We wouldn't see any of these other structures. So the rumen is down. It basically takes up most of the down side of the animal right here, the left side. As is very common in animals after they have died, it does often fill with air from a lot of the bacteria that are present in the rumen, and so you can see it's often an air-filled structure. There are four chambers or four stomachs to the rumen, or ruminant, and we will look at those individually in a subsequent video. But right here, the main one we see is this rumen, and if we look, we can also see this is the fourth stomach coming off. This is the abomasum, or the true stomach, or that is more comparable to what we have in non-ruminant hosts. This net-like structure is what we call the greater omentum. It actually envelops or contains all of the loops of intestines, which are quite numerous in deer. But we can see this is a light, lacy material. It's often got a lot of fat deposited in it, and they sort of wrap around or contain all the rest of the intestinal loops in the abdomen. If we follow sort of the intestinal tract from what we can see in situ, here is the abomasum coming down, and once it starts to narrow, is when we hit the small intestine. And the first part of the small intestine we hit is the duodenum. Then the duodenum goes into all of these smaller loops, these numerous loops that we see here, which is the jejunum. This is all in the small intestine. If you look in the jejunum here, you can see there's a mesentery, sort of this sort of fatty area here. That is what sort of connects the loops of bowels to the upper part of the abdomen, the dorsal part. Often this is where you'll find lymph nodes. They're quite numerous in there. They can be varied in size. They can be sort of a bean-like structure, usually tan to gray in color. These are all your loops of jejunum, and then these continue on until the small intestine, till you reach the end of the small intestine, and you move into the large intestine. And that is where, here we can see it coming in. This is all jejunum loops. And where it makes that T, the end of the T, or the part coming in, that is the ileum, or the last part of the small intestine. When it enters in, you've got sort of this blind-ended pouch, which is your cecum, which we'll talk a little bit about in a subsequent video. And then if it goes the opposite direction, you're into the large intestine. The large intestine then continues on. In ruminants and deer, we have sort of this spiral colon, which is this structure that sort of makes a spiral shape right here. And then it continues on until you get to the end and sort of the caudal part of the abdomen, which is the distal part of the colon, and you can actually see formed feces in there. And so this is feces that is ready to be voided from the animal. If we're back here in sort of the pelvic area, back part of the animal, the main structures you can see is certainly this distal large intestine. Below that, you have your uterus, which is sort of this Y-shaped structure here. And then below that, you can see right here more of a balloon shape, and that is your urinary bladder. So this can often be somewhat complicated when you're processing your animals of what order, and whenever you're dealing with anatomy, you always want to look for landmarks. And so in this distal part of the abdomen, in the pelvic region, if you start dorsally, it goes large intestine, and if it's a female, the uterus, and then the urinary bladder is most ventral. So that's a nice landmark to have as you're going through to see where these different structures are. Other relevant things to see in the abdomen are the kidneys. Here we can see them on sort of the dorsal part. The right kidney is usually closely associated with the liver. They're often covered in fat in many of our deer if they're in good condition. And we can remove that fat, and there you can see it's got almost the same shape as a kidney bean, and it's more of a mahogany sort of reddish brown color. The left kidney is further on into the abdomen below some of these other visceral tissues. So these are the organs we have in situ. In the next video, we will begin to remove them, show you how to remove them properly from the body, and then in subsequent videos go through each one in a little more detail.
So now in this video, we're going to show how to properly remove the specific organs and tracts from a deer for further closer inspection later on. So the first organs that we're going to remove is the trachea along with the esophagus and the lungs and the heart. So the first cut that we're going to do in order to remove that, we're going to do 2 cuts parallel to the jawbone. And we're going to cut the muscle, all the muscle around the tongue, in order to remove that tongue. And along with that tongue, we're going to bring also, once we remove that tongue, we're going to bring the esophagus and the trachea. So the first thing that we're going to do is just cutting all the soft tissue around. And then a structure that we have to go through as we get closer to the pharyngia, we need to cut the cartilage of the iod apparatus, and we gotta make sure that we cut through the cartilage because the bone, it has also, this apparatus has small bones, which actually they're pretty hard to cut. So if we go through the cartilage, that's gonna be an easy cut. So I'm exposing the tongue now. I cut that's a muscle tissue around. Now she's cutting a few other attachments on that tongue. So now we exteriorize that tongue. And then, as I mentioned before, we're going to continue this cut ventrally and caudally. So we can see the trachea right there. So we can see a little muscle on top of that. And on top of the trachea, we can see our esophagus. So we're going to remove those together. As I mentioned before, the first thing we're going to do is cutting those cartilage from the iod apparatus. And then we're going to keep removing these two organs together. Gotta keep cutting all soft tissue around as well. And then we'll continue that cut all the way until the thorax cavity. Mentioned before, we're gonna keep, so there's a muscle that's coming through on top, we're gonna cut that. Also we have some of the vessels as well, so we're gonna cut all through that. Make sure we always have both organs. So we have the trachea right here, as Dr. Brown explained, is a series of cartilaginous rings, and then we have our pliable esophagus, muscular soft pipe that goes all the way into the thoracic cavity. So now we gotta go inside the thoracic cavity in the inlet. I wanna keep removing, cutting the soft tissue around. Basically now we're gonna cut all the tissue around the lungs that are attaching those lungs into the rib cage. So we're gonna keep cutting those also. As we get closer to the heart, we're gonna start cutting some of the large vessels that attach to the heart as well. So we're gonna see some blood coming out of those tissues. Here we can see the aorta artery is leaving the heart as well. So we're gonna cut that large vessel right there. And then we're gonna start reflecting this plug and keep cutting all the different soft tissues attachment of the two main organs that we're removing now. There are the lungs and the heart. Also, we're going to have an attachment of these organs into the diaphragm, the muscle that Dr. Brown mentioned that divides the thoracic cavity from the abdominal cavity. We're going to remove that, and then the whole plug is going to come out together. So now the next organ that we're going to remove is the liver. So as you can see, the liver, as Dr. Brown mentioned, is the first structure that we're going to see. We're going to find abdominal cavity if we're coming from cranial, from the thoracic cavity. We don't have a gallbladder, as Dr. Brown mentioned before, so we're going to remove the soft tissue that is attaching this organ to the abdominal cavity and also to the other organs around. We're going to cut all those ligaments and also the vessels that are attaching that organ to the other organs in the abdominal cavity and also to the abdominal cavity walls. So then, as also we mentioned before, this organ is attached to the diaphragm as well, so we're going to cut that attachment, and then we're going to free that organ, and we'll further inspect this organ in the subsequent videos. Now the next organs or tract that we're going to remove is most of the gastrointestinal organs that are basically the four stomach or the four chambers of the ruminant animal, and also the intestines, the small intestine and the large intestine. So we're going to start removing that basically by cutting the attachment of these organs. Remember that we cut the esophagus, so we have the esophagus connection right there towards the rumen. Then the structure that we can see here, this organ that we can see here, is actually our spleen that we were not able to see before because it's right against the rumen, and as Dr. Brown mentioned before, the rumen is in the left side of the animal. So this is always better to do when if you have some assistance, somebody can keep a constant pressure, such as Dr. Brown is doing now, and basically you just remove all the soft tissues attachments of these organs. And again, we're going to further inspect these organs as we keep in the subsequent videos. So here you can see the distal part of the column. So basically we're just going to do a cut here where that column is entering into the pelvic cavity. So we do a small cut right there. And then we'll place that in a different examination table for further inspection. And the last organs, or the last tracts that remains on the carcass of the animals, are the urogenital tract that is composed by the kidneys and the ureters that goes into the bladder. And also in this case, since it's a female, we have the female reproductive tract composed by several organs that you can see here, the uterus and the ovaries, and we'll talk about those organs in further detail in the subsequent videos. So as a following videos, we'll have a video describing all the specific features on all these tracts and organs that we have removed from the carcass of the animal.